Tickly and dry, chesty and whooping. Are you familiar with the different types of cough? Hi, I'm Ganesh and I'm a pharmacist at Boots. Today we're talking all about coughs, from different types and causes to soothing symptoms. Coughing is your body's way of clearing irritants from your throat and airways. They're very common and usually clear up on their own within 3 to 4 weeks. While most coughs are caused by viral infections like a cold or flu, other causes include smoking, allergies like hay fever, heartburn, infections like bronchitis, and nasal mucus dripping down the throat. If your baby or child has a barking cough, this may be a sign of croup. You should call 111 or see a GP if you think this is the case. There are many types of coughs, including dry cough and chesty cough. A dry cough often feels tickly and is usually caused by irritation and inflammation in the throat. A chesty cough brings up mucus and phlegm and often accompanies a common cold or other respiratory tract infection. Whooping cough is classed as a dry cough and it is a bacterial infection that affects the lungs and airways. Its main symptoms are intense, uncontrollable cough, difficulty breathing after coughing, or bringing up thick mucus. Sometimes a whoop sound is made when gasping for breath between coughs. If you suspect you have whooping cough, speak to your GP for advice. A short-term cough caused by a viral infection will likely get better on its own, but there are some things you can try to help ease any discomfort, such as resting, drinking plenty of fluids, drinking warm water with lemon and honey, pain relief like paracetamol, and considering taking cough medications. Sometimes, a cough that is caused by a cold can be worse at night due to postnasal drip or even just lying down. When sleeping, try to keep your head a little bit upright. You should try and stay home and avoid contact with other people if you have a high temperature and don't feel well enough to do your normal day-to-day activities. You can also pop into your local Boots pharmacy and ask our pharmacist about cough syrups and medicine. Cough products can help soothe the cough and make you cough less. While most coughs clear up on their own, it's important to see a GP or call 111. If you've had a cough for more than 3 weeks, you're losing weight without trying, you have a weakened immune system, your cough is getting worse quickly, you feel unwell, you have chest pains, the side of your neck feels swollen, you find it hard to breathe, or you're coughing up blood. There can be a lot of misinformation out there surrounding coughs, so let's set the record straight. All cough needs antibiotic. No, most coughs don't require antibiotic as most are caused by a viral infection like a cold, which antibiotics do not treat. If a cough is caused by a bacterial infection, a doctor may prescribe antibiotics. All coughs are contagious. Not all coughs are contagious, but they are when they are caused by an infection like a cold, and they can be spread through coughs and sneezes. Cold weather causes coughs. The cold weather itself doesn't cause a cough, but it may exacerbate the respiratory symptoms like coughing worse. As mentioned, coughs are very common, but there are plenty of things you can do to help relieve discomfort. If your cough lasts longer than 3 weeks, or you're concerned about your symptoms, speak to your GP for advice and to investigate any underlying causes. And if you're looking for more health-based content, make sure to like and subscribe to the Boots YouTube channel and check out our dedicated Health Hub for further advice and support.